In this episode, I have a chance to talk to Jeff Shaw, who is a personal trainer right here in the Yucatan. We talk about the shoulder pain that he had, the surgery that he actually had done to the shoulder in Mexico, and the impact that the pain had on his life as a father and also with his working as a personal trainer. Have a listen. Hola, amigos. Welcome to the No Pain Podcast. I'm your host, Coach Darwin, and I'm a licensed physical therapist. And what I try to do on this podcast is bring you interesting people from all corners of the world and talk about pain and conditions that they're currently experiencing or have overcome. And today I bring you Jeff Shaw. Jeff is a personal trainer here in the Yucatan, and as he describes it, self-described, I gotta read this. He's an active lifestyle habits coach, which is probably a much better term than personal trainer. Describe to everybody what that means to you, what that title means.
Sure. I mean, well, first it kind of comes back to when you say personal trainer, everyone usually has something in mind, and it's not always necessarily a good thing. It's not usually a bad thing, unless they've had a really bad experience with a personal trainer in the past. But it can be kind of disregarded when it comes to the kind of health world, right? And the other thing too is I started to find that my clientele were really not, high level athletes anymore. They were more in the 50s, 60s looking to maintain a general level of fitness, not some, PR on a big lift. It's like, all right, can I still do the things that I need to do on a regular basis and, just be generally active in order to support a lifestyle that they've maintained for a while and they want to continue to do so for decades to come.
I love it. I love that title. And, functional training was big for 5 seconds a minute ago, but this, lifestyle habits are two really sticky things that change someone's life for the better. Personal trainers, as a physical therapist, we would see all kinds of, great personal trainers that we'd send our clients to after discharge, or we'd get patients coming in because of bad personal trainers. And
I was probably both of them at some point in time in my career.
Probably. We used to have a problem because a lot of the personal trainers would put PT behind their names on their cards. And it was a big no-no. And every time we saw one of those, we're like, do not send to them. Okay, so you kind of touched on this a little bit. Your client base is more in their 50s or 60s. What is your fitness philosophy, would you say? Like, if you were to, on an elevator pitch, what would you describe to a new client?
So the age range, I typically kind of have a soft cutoff at around 40.
The low end.
Yeah, on the low end. Just mainly because it has to do more with mentality. Like, we live and train differently in our 20s. And you probably can attest to this. Like, you did things when you were 20, or your goals were something, and not that there's anything wrong with it, but they shift, especially if you start having kids or anything like, you're starting to get older. You're not just trying to look good on the beach, you're trying to be functional throughout life, right? And so that tends to probably, with most people, shift somewhere around there. And so that's kind of why I work with mostly 40 and over. And when it comes to more or less the philosophy around, fitness, especially for people that are a little bit older and trying to get a lot older, stick around for a while. There's a great quote from, I'm sure many people may have said something like this, but I always remember hearing it attributed to the tennis player Arthur Ashe, which was, start where you are, use what you have, and do what you can. And it's start wherever you are, not where you used to be in the glory days or where somebody else is. Just wherever you are is the best place to start. Start there. Use what you have, which means don't look for excuses of like, oh man, if there was only a gym nearby, or if there was like, oh, I would do this if, whatever you've got available, which your body is enough to start with, and just do whatever it is that you can and start there. I think we should move every day. I don't have a problem with rest days, but like most of us, especially in that age range, aren't training to an extent where we really need a total day off. We should be moving. We should be, kind of, not to sound cheesy, but celebrating the body that we're in, right? And using it. And I think, you know, when it comes to fitness, find something that you enjoy doing. Like, have fun with it. This shouldn't be like homework.
Yep.
You know, so I have clients that train with me. Usually it's like 2 or 3 times a week.
Okay.
I remember one client was training with me 3 times a week, and he was trying to see if he could get in a 4th. And I wasn't like, no, I don't do that. But I just talked to him, basically said, I'd rather in the other days, we find something else for you to do. Like fun that you like. And this guy, I was get back into playing tennis. And I was like, awesome, cool. You like playing tennis? Get back into doing that. Have fun. If you like to go dancing, go dance. You know, like looking for activities. And so that's why it kind of comes back to the idea of being an active lifestyle habits coach. You know, I train and I program for clients, but then I also really help them find other ways to be active. You know?
Yeah. And you're a mover yourself.
Yeah.
I know you're a very active guy. What kinds of things do you do on the weekend for fun for yourself?
All right. Yeah. So that's like, so I have 2 kids. They're 9 and 11. Sunday's my one day that I don't see clients.
Oh yeah. Good for you.
And so that's my day that I can, and that's the day that, you know, my kids don't have school. They're not in dance. That's a day for us to just play and have fun. And so we'll go out, we'll take the dog to the park, we'll jump in the pool, whatever it is. We'll go to the trampoline park. It's a totally playful kind of mentality. And I think that that's probably another thing that I try to help people with that are older, because the 50s or 60s, they're probably not around a lot of kids anymore, right? My kids reminded me of just play for playing's sake, you know?
Point,
And I think we should never get to the point where we don't do that. I remember, it's kind of a funny story. We were all together, I think, for the first time, my wife, the whole family, for the first time after the pandemic, or, you know, not after the pandemic, but when we could actually get together again. And we were jumping in the pool, and my father-in-law jumped off something and did a cannonball into the pool. And this is an older guy, white hair, white beard, doesn't look like the guy that typically does a cannonball. And I thought, that's like a life goal for me. Like, don't forget to like, I want to just play and have fun, you know? And I think that that's a really important element to living a long, healthy life, you know? So yeah, so my day off is based around playing.
Okay.
Yeah.
Okay.
And then the training that I do, you mentioned functional fitness. It was like it was a buzzword for a minute. And it was, and it's
watered down. Like
it is.
Yeah.
And when I'm with my clients, like, we practice what I always understood as functional fitness as in movements that we see in everyday life. So a squat, we're sitting now, we got to stand back up again. I go to the bathroom and sit down and get back up again. So things that serve like everyday life. That's how I always kind of understood functional fitness.
Yeah.
But then also I take it to, what individually do you do on a regular basis? Do you garden? You know, okay, cool. We're gonna get down on the ground. I mean, I get all my clients down on the ground all the time, because I think that's really important, especially as we age, that we're not afraid of being down on the ground.
They can get back up.
And they can get back up again. But yeah, that's like most of my training for me personally is, you know, the fundamental movement patterns of push, pull, hinge, squat, lunge, rotate, carry. I just try to incorporate some level of that sprinkled throughout the week.
Yep. Big biceps look great on a beach. Not going to help you get up and down the stairs. Not going to help you put some luggage in the overhead bin. So,
So it's like, what serves me so I can continue to do the things that I like to do. That's more of where I come from.
Well, that's a nice segue now then to talk about your injury and what we're here to talk about. So Jeff trains a client right near one of my neighbors, actually. So used to kind of seeing him come and go during the day. And one day I see him with a giant sling on his arm. And I'm like, uh-oh, this can't be good. Why don't you tell everybody what happened?
Sure. So my latest injury, anyway, is what Darwin's talking about, because it's not my first. And that's just really all coming from an active lifestyle. Like it's happened, and accidents have happened. It's just, kind of, it is an unfortunate part of a lot of people's lives.
Being a human, I always
Being
say.
a human, yeah. I mean, you got to get the car out of the garage and open it up every once in a while,
Yeah.
This one is my shoulder, and I had what's called a slap tear in my right shoulder, and I also had some fraying in the connective tissue of most of the muscles of my rotator cuff.
Mm-hmm.
So Darwin can certainly explain in better detail than I can everything that's going on in there, but basically.
Right. So before we go any further, let's just throw out some definitions here. So we're talking about a SLAP lesion, SLAP. And what that is an acronym that stands for superior labral anterior to posterior. So what we've got in the shoulder joint is it's a ball and socket joint. And the socket aspect is the scapula, and the ball part is the humerus, or the upper arm bone. So where those two articulate and join together, it's a pretty shallow seated joint. And the reason for that is because we need a lot of motion from our shoulder. We need to be able to internally rotate, externally rotate, come across your body, all planes of motion. We really need good, healthy amount of motion in the shoulder joint. So our ball and socket joint is pretty shallow. Now, the danger to that is there's not a lot of stability inherently there. And you don't want your shoulder joint coming out of socket. It's a dislocation, and that's very painful, and we can talk about that in an upcoming episode. We've got a lot of muscles, the rotator cuff muscles especially, help attach to the humerus, to the arm bone, to kind of keep it seated into where it's supposed to be. But we've also got a circle of connective tissue that's called the labrum. And what that does is, among other things, it helps to increase the seat of that joint. So there's just a little bit more support and stability for that shoulder bone to articulate in the glenoid. Now, where we get into trouble is typically with a lot of our overhead athletes. So our tennis players, our pitchers, our volleyball players, a lot of overhead motion can lead to damage over time in this labrum. So the actual injury itself then, with all the wear and tear, is a tear on the labrum, on the superior aspect, from anterior to posterior. That's not to say that we can't have a traumatic injury where someone, maybe a rugby player, falls onto an outstretched hand. That also can be a traumatic tear of the labrum. So there are essentially 4 different classifications of tears of the labrum. Now, actually, there's 10, but to not complicate this any more than we need to, there's basically 4. A type 1 tear sometimes doesn't need surgery. A 2, 3, and a 4, the complexity is different with each one of those. And again, there's subgroups within each type. But a lot of times those are required to have surgery. So hopefully that sheds a little bit of light. Let's get back to Jeff.
Okay, so describe how you knew there was a problem in the shoulder. What were you feeling?
Sure.
And when?
I think probably the first movement, or the first time I really was like, ooh, man, aside from maybe during a workout where I felt like, oh, that didn't feel quite right. I was doing a lot of pull-ups and...
what did you feel specifically?
It was just instant sort of like, I don't want to say the word tear because I think I only putting that on it now that there was, it was described as what the problem was.
Right.
It just felt like it was a pretty, it was a burn sort of sensation, and it just like, oh man, that didn't quite feel right. But it wasn't super drastic. And then I think, I was driving and I went to reach to grab something from the back seat.
Yep.
And I was like, oh, that's not why. That shouldn't do that. That shouldn't feel like that, you know?
Yeah.
And I put up with it for a while. I tried to, do my own thing because I didn't think it was quite as drastic as it was. But yeah, that was probably like the initial.
And how did you know then that you needed surgery?
After a little while, I just thought, okay, man, this isn't getting better. And I know it's like, if it's not getting better, I'm making it worse.
Yep.
That was like, I know enough that, these pains should, occasionally we have these aches and pains that almost feel like they miraculously take care of themselves.
Yeah.
And you could speak more to what exactly is going on in there, but that, that happens. When that didn't happen, I was like, okay, something's going on, and I think I'm going to make it worse.
Are we talking days, weeks, months,
Weeks.
years? Okay.
Weeks to months.
Okay.
Yeah.
Was there any catching, popping?
No, not really.
sensations?
Not really. It was really when I took it out into this external rotation, like opening up here. I felt this like, oh man, this is tight and it's painful. It's not just like sore from like, oh, I did pec flies, for days, and now I'm, sore from that. It's just like this is wrong. So,
Right. Okay.
Yeah.
Was it causing difficulty with you actually working with your clients?
Yeah. So, all of a sudden it's like, I'll demo a movement for new clients, or if any clients ever like wondering, about a movement. All of a sudden I couldn't demo, for instance, doing say like dumbbell flies or something like that. And then I also started noticing it kind of in, outside of the gym and outside of the work area of like, picking up and throwing a ball for the dog. I was like, man, this is uncomfortable. What's going on here? Yeah. And I'm not ambidextrous when it comes to throwing.
Maybe Frisbee might work.
Right.
That motion there. You got a retrieving dog, right?
Yeah. Got a border collie. So like she's not amused if I only throw it a few feet.
right. Come on, Dad.
Yeah.
So something I'm very interested in here, and I haven't had much experience, I've been in Yucatan for almost 5 years now, is the medical system seems pretty good from what I've seen. I got stung by a stingray once, and that was about my only...
Did you step on it?
That's maybe for another video, my pain experience. So I haven't, luckily, knock on wood, had to do much other than preventative screening, stuff like that here. Walk me through what the surgical process was like here.
Sure. I'll backtrack just a little bit because I do have some more experience. Like I said, I've had other injuries. I had a knee surgery about 10 years ago. Where and I won't go too deep into this, 'cause it's not what we're talking about, but I had to have knee surgery and I had to, rehab from that. Everything was done really, really well going into it and everything. And also in between that and the shoulder surgery, I had 2 hernias in my low back.
Okay.
And, one of the greatest things that I heard was from the doctor was, there's a surgery that we could perform. I don't want to do it yet. And I was just like,
fantastic.
That's awesome.
Yeah.
Now, as a last resort, I think great. And that's kind of how it was explained to me.
Yeah.
It was like, hey, we can do this. This is in our back pocket. I've performed it many times with great success, but let's see with some PT and so, you doing your own work, working with that physical therapist. Let's see if we can get you back feeling good and mobile without needing that. And now, obviously,
amazing.
Does that speak to every doctor here? No, but it was like, yes.
What a novel concept.
I know, right? Like, and so, just I felt like I should share that because I thought that was, it wasn't like, okay, cool, yeah, I'm just buying somebody a new boat, like every few years I'm going in with a new,
frequent flyer car.
Yeah, exactly. And so with this, it was, it was necessary, so it wasn't a question of like, all right, does he really need it, or is it, more aesthetic? And I was like, I knew it was needed and he knew it was needed. the whole process, very smooth, explained everything, explained, okay, what to expect from the beginning to the end of the day of the surgery, what to expect when getting out, and then how to, the step-by-step process. Like, it was a very open kind of conversation, which instead of, I've definitely had this experience in the past where it was like, you almost expect them to sit on a chair that's slightly higher than yours, because like they know, and they're kind of talking down to you of this, like from this place of importance. And this I've had this with multiple doctors here, whereas, no, like this, they honestly, this is the situation that you're in. This is what I can do. This is the most likely outcome. And, it's just very sort of relieving, when you're about to go into a potentially very life-altering procedure,
Right, right. And so for the locals here, was this at Star Merida or?
This was at Star Medica.
Faro? Yeah. Okay.
I've been to Star Medica and Faro with, different doctors there. I've been to Clinica Merida too, great doctors there. Again, can't speak to all of them, right? But like, I've had great experiences in each of those places anyway.
Great.
Yeah.
Good to know for all of you who might be watching this, not living in Mexico, that it is an option.
Yeah.
It is an option to have some medical care down here.
Yeah.
Medical tourism is quite a thing. Okay, let's fast forward now. You're out of surgery. Now you're wearing your sling. How long did you have to wear?
God, I want to say the sling was 6 weeks to 2 months. I think about 6 weeks. Yeah.
Okay. And you were still working during that time.
Yeah, I didn't stop.
Okay.
I mean, I took a couple of days off after the surgery, I think. But
so how did you manage to do that? Very active job. You need to assist. You need to guard people.
Yeah.
Even. How did you? And it was your right hand. So how did you? What accommodations did you make?
Luckily, all my clients are very understanding. It's interesting because I see most of my clients in their home, and I bring equipment for many of them. So it made that a little bit more laborious, one dumbbell at a time and stuff like that. And really it was just like, okay, adapt to the situation. Like I can still spot people. Obviously, I mean, I specifically doing bench press, I was like, listen, the situation that I'm in, I can't spot you on, your max lift.
Right.
Because I'm not going to be able to hold that weight up off of your chest.
Yeah.
So we do low weight, higher rep stuff in that time, things like that. I had to adapt to, kind of what I was talking about earlier. It's like, oh man, I can't perform the movements that I'm asking my clients to perform. Not all of them anyway, right?
You're not doing burpees.
I'm not doing. Well, so that was a really interesting thing because part of it was like, all right, unilaterally, like one arm.
Yeah.
Okay, cool, that's off the table. But there's a lot of bilateral movements that push-ups. I love push-ups. I love burpees. I love stuff like that. For my personal, training experience, that had to be altered. But like for with clients. I've recorded demo videos for all of pretty much all the movements that I program, so I could always just at least go to that, like really quick, like here, check this out. This is what I'm looking for. Pause, focus, focus in on a certain area, like see how the arms, the shoulders a little slightly internally rotated, or whatever the lift was or exercise. So it was doable. It just took a little kind of think outside the box here.
Yeah,
like when you see a dog on the street that lost a leg, like they're not sitting there complaining about having 3 legs. They're like they still got 3. They make it work.
Right. Still get along. Just don't tell them they got 3 legs.
That's right.
That's great. That adaptability, and then you also have one component of your work is done online as well.
Yeah.
So I mean that doesn't really change.
That didn't change too much at all. With the exception of like showing a movement, but the same thing would happen. And I'd usually, for instance, if I had a client for a live online session, I would forward them the demo videos of the exercises that we would do in our workout, so they could take a minute to like go through it and they'd be familiar with it.
Yep. Okay.
And then, I could explain the rest of it if there was any, fill in any gaps if there were any.
Right.
Yeah.
All right. So you've got a great family life, two younger kids, you got a dog. What is it like for 2 months, maybe, to not be able to pick up your daughter?
That was probably like when it came to outside of the work and the training and exercise side for me was, it's like I hate telling my kids I can't do something, and I don't know if that's that like underlying, like, my kids are still young enough where I'm kind of still Superman.
Right.
Yeah,
don't forget. Yeah.
And so I was like, I can't do that.
Yeah.
And like, I have no problem asking people for help. Like, I don't say no problem. That was I work at that, but like, I can't do everything, and people, asking somebody for help when I genuinely need it. But when it's like that's like one of my favorite things in the world is picking my kid up and throwing him into the pool or something like that. It's like, I can't. And you're a father too. You get it. Like, this time is fleeting. Yeah. Now, I mean, I can be their dad forever. They're going to be my kid forever. But they're only going to be young for a certain amount of time. So like, they're only going to want you to pick them up.
Yep.
Till they don't anymore. Right. And then that door is kind of closed.
Yeah.
And so that was kind of motivating. Also, it's like, all right, don't slack out on the rehab. Like, get yourself recovered so you can still do the things that you love to do.
I think that's a great message. You touched on it, is asking for help. So for anyone out there who's dealing with something, who might have trouble asking for help, I think that's it's a really great point. And did you find yourself now or then asking more for help? Even did it get a little more comfortable? Over time?
Yeah, definitely. So my whole thing when it comes to this, and it also is to the mindset that I think has been really beneficial for me in recovery from an injury, is to not be as focused on what your limitations are in that moment. So for instance, I'm just going to detour just a slight bit when it comes to training with my knee. I remember when I had the knee surgery, it's like, all right, well, I'm going to get really good at push-ups. It's like, I can't use that knee for a while. And it's going to take some babying back into it. Like, what are the things that I can do? And mentally, that was huge, because it was like, all right, like, it can be really, really depressing to be reminded of the things that you can't do, right? And so when it came to like personal life, you're reminded, like, okay, aside from just being able to pick up the kids, like, what are the things that I can't do? So I was really just trying to find, okay, where is the line though? I don't want to ask for things that I don't really need. I don't want to be that person.
Yep.
And if I can find where the line is on the things that I can and can't do, make sure to do all the things that I can do. Okay. Because physically, I think it's good for me because I'm keeping active, right? Mentally, it's good for me because I don't feel useless. And I think those two things, if we can keep those from dipping too much, man, that makes such a difference. And then I'm not asking that much of people around me, so I don't feel like a burden. It's like, hey, I can carry the big water jugs because I can carry them in one arm. I can put them here. For a while, I couldn't lift them up onto the counter. So it's like, okay, but I can at least get like, just as an example, it's like, all right, what can I do as opposed to what can't I do, and at least get that done. You know what I mean? So I don't feel like I'm asking for everything.
Well, Jeff, you really gave us some great nuggets here today. These are a lot of actionable things for sure. As we kind of close out here, what advice would you give to somebody who currently has a SLAP lesion, is going into surgery, or is just newly recovering from surgery? What one bit of advice would you give somebody like that? I would say start practicing to write with your left hand, because that sucks. Your opposite hand. Your opposite hand. Because that for a stretch, that was kind of tough. But no, in all seriousness, I would probably go back to that. Maintain the mentality of,
You know, if it's one limb that's now out of commission for a little bit, that's 3 if you had 4 working limbs before the surgery that are still fine. Use them like as much as possible, you know, like do bicep curls and shoulder press with the other arm and do squats and, you know, things like that. And again, it's not just the maintaining the physicality of it, but mentally, like it just gets you through a day because you don't feel like, oh, I didn't do anything today, you know? But also, you could speak to this. This would be interesting to get your perspective on it. If I'm training this arm and these legs while this is just kind of sitting there, I don't know. I feel like it's good for that shoulder too. Just like I don't even know how to explain it. It's just if the rest of my body is active, I think activity is so important to our body for general health that it's in some way, I'm not, like I said, I don't know how to articulate it or how to explain it, but I feel like it's good for the area that's also not doing anything.
Well, on multiple levels, actually, from a physical standpoint, there are studies. There's great research that shows the crossover phenomenon, where it's something that we'd work on with immobilized joints or limbs. You would work the healthy side, and would actually the opposite side, the immobilized side, would actually show muscle gains.
Right. Okay.
Patients who were experiencing stroke, you'd work on the good side, and you'd have a crossover effect. So there's a lot to dive into there, and actually that's a great topic for another thing. But yeah, I think of the mental aspect of moving the body, in addition to the hormone release and everything. It's a real thing.
Yeah, I think that's probably my biggest kind of takeaway is to spend less time focusing on the injured area. Obviously, spend time focused on that injured area to recover, but to maintain the mentality of, look at all the things that I still can do. What's in my control.
Well, great stuff, Jeff. Really appreciate your time.
Darwin, my pleasure, man.
Jeff, where can they find you if they're looking for you?
Oh, sure. Website is longevity360.life. All the socials are all at longevity360.life, and that's the easiest way to reach it.
And I'll drop it down in the comments below. So thanks for your time, guys, and we'll see you soon. Hasta luego. So I hope everybody enjoyed that conversation with Jeff. And if you're someone who is experiencing shoulder pain and you suspect that it might be a SLAP lesion, I'm going to drop a video here where I talk a little bit more in depth about a SLAP lesion from a structural perspective and different surgical options that might exist for your shoulder. And I'm also going to post some videos that you can do to help mitigate some of the pain that you might be having. So I appreciate everybody for tuning in, and until next time.